Again, we're back and we're going to continue our discussion on coding infectious diseases, finishing up on sepsis and getting into HIV and other infections. Okay, let's finish up our discussion on severe sepsis. And when severe sepsis is present on admission and meets the definition of a principal diagnosis, in other words, the reason that the patient was admitted after a study that we learned about last week, the underlying systemic infection is going to be assigned as the principal, followed by the code from the R65.2 subcategory. Again, R65.2 can never be a first listed or principal diagnosis. When a patient's admitted to the hospital for treatment of sepsis and severe sepsis develops during the hospital stay, again, the systematic infection is coded first, and the appropriate code is going to be signed as the secondary diagnosis with the present on admission indicator of no reported. If a patient's admitted to the hospital with an infection in a particular body system, such as pneumonia, and that evolves into sepsis or severe sepsis, again, the systemic infection will be coded first, such as a code from category A40 or A41. We would then use another code for the localized pneumonia, again, the pneumonia being a manifestation of the infection. And again, as we've seen, if severe sepsis is present, another code from R65.2 is going to be assigned. Now, if a patient is admitted for treatment of said pneumonia or some other localized infection, and the condition worsens to the extent of having sepsis or severe sepsis, the localized infection is going to be coded first. Again, the designation of the sepsis or severe sepsis, the infection is what's causing it. Additional codes would also be used for the sepsis that develops in the hospital. So this happens sometimes for post-procedural infections. You can have post-procedural septic shock. Again, all this starts with the infection itself. A lot of interest in human immunodeficiency virus, HIV as we refer to it, as AIDS. And what does AIDS do? The virus destroys the specific blood cells called CD4 plus T cells that fight infections. And without enough T cells, of course, the body's immune system can't block bacteria or virus, which makes the patient open to all types of different infections. Anyone with fewer than 200 T cells or a percentage of less than 14% is considered to have AIDS by definition, and AIDS is typically the late stage of the HIV infection. The code for active cases of AIDS or AIDS-related complex, or what you see sometimes described in the records as symptomatic HIV infections, are all the same code. They're B20. We also have asymptomatic HIV infectious status. So in other words, these are people that test positive, but they have no active symptoms. These are not B20. These are asymptomatic, meaning no symptoms. B20, you have symptoms. So therefore, B20 and Z21 are always mutually exclusive. Likewise, R75, which is an inconclusive lab test for HIV, is mutually exclusive with asymptomatic or active HIV disease, active AIDS. So it's one of these three. It can't be two of the three or 3 out of 3. We only code confirmed cases of AIDS. So when you see terms that are saying suspected, possible, other things like that that reflect uncertainty, we don't code those. If it's that ambiguous, the patient should be asked to clarify what is known for certain about the patient. For instance, symptoms, inconclusive test results, or what have you. Any HIV-related illness, like Kaposi sarcoma, would require a minimum of 2 codes. The B20 would be first, and then the code for Kaposi sarcoma. And you can see this in the tabular. Let's take a quick look. Here we see the HIV. What does it include? Acquired immune system, AIDS-related complex, and symptomatic HIV. So in this case, the code first, HIV disease, and if it's applicable, for example, in a pregnant woman, postpartum, it would be 098.7. Use additional codes to identify all manifestations. And we can see some of that when we look for the codes for Kaposi sarcoma. Let's take a look at that. So we see main term, sarcoma, Kaposi's, and we see that by the site. Let's go to that site in the tabular. And then you see it right here, Kaposi sarcoma. And then important note right here, in red, so we're going to pay special attention to that code. First, any human immunodeficiency virus first, which is the B20, as we talked about. And again, something that's kind of a good general rule of thumb with a few exceptions is anytime we have something that's complicating a pregnancy or impacting a pregnancy, such as HIV-related illness, that's kind of a separate carve-out from everything else. So in this case, it'll be a code from the OB chapter, which starts with an O. So this would be subcategory 098.7. That would be a first code, and then there would be additional codes to identify the type of HIV virus. And this is in the guidelines as well. And if a patient with HIV disease is admitted for something completely and totally unrelated, such as car crash, what have you, the unrelated condition, and again, going back to our general guidelines about what diagnoses we encounter, we're going to want to capture and code anything that is impacting the management of the patient, and HIV disease, AIDS, ARC would certainly meet that criteria. We talked about how asymptomatic HIV infectious status is mutually exclusive, right? And with Z21, we can have the patient has HIV virus in the blood, but don't have any symptoms. They're still positive. They just don't have the disease. This is totally different than the B20. Any patient with a prior diagnosis of HIV-related illness is coded as B20. I've known of several people that say that I'm no longer have any symptoms. I no longer have AIDS. This isn't true in the sense of coding purposes. Once they have the manifestations and active AIDS, they always consider having it. It's a one-way path from Z21 to B20. And again, we have encounters for HIV testing, which is Z11.4, main term encounter. And if they're high risk sexual behaviors, we would use the additional codes such as the Z72.5 subcategory. And if that results in counseling, it's going to be the HIV counseling, the Z71.7. And that's all I have for you. Come back, and the next video lecture will be discussing other viral and bacterial infections. We'll see you then. Bye now.